Thank you. Mr. Davis, you're recognized.
Thank you. Thank you, Mr. Chairman, and let me thank all of the witnesses. You know, it's very interesting to me that on Monday night, every Monday night, I have something called Couch Chat with the Doctors. And we have 5, 6 physicians every week. And we just happen to have been discussing this issue on Monday. And I'm reminded there are some things that we know, and then there are some things that we speculate about, or we project what might happen, what could happen, what should happen. One thing that we know is that in 2014, a Supreme Court decision gave states the choice of whether to expand Medicaid to cover adults with incomes below 138% of the poverty line. As a result, individuals earning between 100 and 138% can qualify for a premium tax credit in states that do not expand Medicaid if states don't already cover those individuals. And as a result of the Affordable Care Act, millions of Americans are eligible for a premium tax credit that helps them pay for health coverage. The American Rescue Plan Act increased the size of the credits and made more people eligible for them beginning in the 2021 coverage year. The Inflation Reduction Act extended these enhancements through the end of 2025. The Republicans have refused to extend this tax credit to assist people to buy health coverage through the market exchange. Yet all of the measures that we have been talking about are tied to the affordability of health insurance. And also SNAP and Medicaid benefits were cut in the big ugly law. Many of the beneficiaries on Medicaid, of course, also get very low money in which to live because their Social Security checks or whatever their retirement checks are really aren't that great. And so talking about coordinating healthcare is a very interesting topic because I'm amazed if we cut hospitals, we cut health centers, if we close the numbers that I've heard that have closed in rural America. But I can tell you we do the same thing in urban America. I grew up in rural America, and there were things we were taught. Things like you can't get blood out of a turnip because it's just not there, there's nothing there but turnip juice. And no matter what you do to it, you're still going to get turnip juice. We were also taught that if you cut green corn, it will die. These are rural conversations in rural America. And so if you're trying to coordinate and you've closed the hospitals, you've closed the health centers, you've cut graduate medical education, you're not training the personnel that you need, and even telemedicine, which takes up a little bit or some of the slack. What is there to coordinate? I mean, I think coordinate means bringing it together. Mr. Cornell, is that a way to do a good job of coordinating?
It is hard to coordinate your care when you can't access it at all. So it's a challenge for patients.
Thank you, Mr. Chairman.
Thank you.